So this is an example of the pre-anesthetic blood work that we run before every procedure. In the textbook, it describes what a minimum database is, and that includes a PCV, a total solids, a blood glucose, a BUN, and a ALT and alk phos. I think also a creatinine. And that is just an idea of a minimum database. You want to make sure that your patient's kidneys and liver are in working order to be able to receive anesthesia. So as you can see, we run a glucose, creatinine, BUN, total protein, ALT, alk phos, and this patient's values were all within the normal range. She was just a 6-month-old dog. And so then on the next page, you have our actual sedation record, and that's where you will find her PCV. We run that manually, and total solids in-house. So this piece of paper is going to have the patient's signalement on it. So it's a canine, the breed is a Klee-Kai. She's a female, 6 months old, weighing 11.8 pounds. And based on the patient, you would choose your anesthetic protocol. So in this case, in our practice, we pre-treat every patient with hydromorphone and acepromazine. The acepromazine is where you can be pretty flexible as to how many mg per kg. It depends on your patient's level of irritation. So in this case, this patient was pretty nervous, so I went 0.03 mg per kg. The safe range would be 0.01 to 0.05 mg per kg, depending on your patient. She wasn't bouncing off the walls by any means, so I just did somewhere down the middle. And then the hydromorphone is always 0.1 mg per kg per patient. The next thing that we want to choose is what we're going to induce with. So we chose propofol. The healthy range is anywhere from 4 mg to 6 mg per kg. For her, we did 4 mg per kg because she was getting a pre-treatment. And then afterwards, you're just choosing what pain meds to go home with. So we did a pain injection of meloxicam in-house, and then we're sending the patient home with meloxicam liquid to continue at home for a week. Other things you'll find on the anesthetic record are if they're getting any surgical fluids. So we were doing LRS at her 2 times maintenance rate, which is 27 mLs per hour.